I didn't understand that, and I think that ACORN may be a prime example of these community organizations helping to educate the American people as to what alternatives are available. There are also provisions in the health care bill that allow for a rationing of health care called comparative effectiveness, which looks at cost-effective treatment. Well, cost-effective treatment means what can we do for the least amount of money to make people happy? Is it going to improve quality of life? Is it going to extend life? The answer to that is no. It may save money, but it's not going to make you folks any healthier or happier. Are there alternatives out there? The government will tell you no. I think if you look at HR 3400, I believe, it is more of a conservative bill. It contains patient choice for insurance, insurance pools for high-risk individuals, the opportunity to buy across state lines in terms of competitiveness, medical liability reform saving between $60 and $108 billion in defensive medicine expenditure reduction, meaning every test that I order to CYA is the perfect example that I would use in my office. I didn't know if I would here, but that is the test that I order so that maybe if the patient has a bad outcome in the end, I can at least have something to fall back on and say, you know, we looked at this, it was not the case. So you have to look at all of that testing. If I could just come up and say, you know what, you've got a headache, you probably don't have a brain tumor, let's do this for a month and try it. Now I have to order a CAT scan because if they had a brain tumor, I could be sued tomorrow. So the deficits can only go up. I can't see how that they would go down. The government has never done anything very efficiently. You look at cash for clunkers as the most recent example. They couldn't do that. What makes you think that they can manage your health care dollars? Finally, they talk about all these other great health care plans in other countries: Japan, Germany, Canada, France, England. Most of these systems are almost bankrupt. They are limited with physician access, long waits, a generalized dissatisfaction, and a growing concern as to how are the young people going to pay for the health care of the aging population. We are going to see that in the next 1 to 2 decades. How are we going to be able to pay for this? So in conclusion, this greater than 1,000-page bill does not outline the necessary steps that are required to bring about health care reform that covers those without insurance. It must include tort reform or liability reform, portability so that you can take it from job to job, accessibility so that I can go out and I can entertain the private sector and purchase insurance from X, Y, and Z insurance at a reduced rate with good coverage. And it cannot include coverage for non-legal, non-paying citizens. The proposed changes will likely increase the state's spending, i.e. your taxes will go up at the state level because of increased Medicaid numbers. They're going to force more people into the Medicaid rolls. That's a cost share between the federal and state government. It's going to decrease spending at the Medicare level, particularly at the Advantage plans, forcing those folks into a public or a single-payer system. The doctor shortage, I don't think the government has any idea what may happen if this goes through. The mass exodus just from people leaving because of being able to not provide the quality of care that we want to provide would be mind-boggling. So, if healthcare reform happens the way that it is currently being prescribed to you folks, it will never be able to go back to the way that it was. My patients have a tendency to feel that it can. Once you explain to them that once insurance companies are gone, hospitals are gone, doctors are gone, you're not going to get the same program that you have today. Jobs are being lost because of cap and trade, card check, government motors, and this current healthcare debate. Every day, jobs are being lost because of concern. Small businesses aren't spending any money. They're not employing more people because they don't know where this is going to go. If you and I were to remodel our homes, we would not tear down our home and start over like the government is implying that we should do to cover 10% of the United States population in regards to health care. I don't think it should take over 1,000 pages of a bill to provide this coverage either. Just to remember that if you're not part of this solution, and maybe the current administration is not, then they may be part of the problem. Thank you for the opportunity to allow me to talk to you folks today. I do love my profession. However, I cannot encourage a fourth generation of physicians in my family to follow this endeavor. I love this country and what it stands for. I thank God every day for my family that puts up with my profession. God bless all of you, and God bless America.